A surge in winter illnesses is straining health systems across the country as state and territory ministers demand greater funding support from the Commonwealth. A combination of flu, COVID and another respiratory virus known as RSV has left emergency rooms overflowing and forced many hospitals into a state of emergency. Co-host of the Health Report and What's That Rash, Dr. Norman Swan, takes us through the severity of this latest influx of illnesses.
It's always acute at this time of year, and the added variable is that now you've got an extra virus in the mix, which is COVID-19, which wasn't there pre-pandemic. Sounds like the obvious thing to say, but it adds a significant burden to what was there already. Flu is probably at a slightly lower level than last year, but it's gone up maybe 20% in a week, at least in New South Wales. And COVID is going up as well, more slowly, but it's the wastewater testing, particularly in Victoria, is showing a really rapid rise, and that the new variant of COVID is showing an increase in wastewater and to a lesser extent on testing. So that is to come on top of flu. So 4 or 5 years ago, you only had flu and RSV, this respiratory syncytial virus, and now you've got 3 of them out there, and that does put extra strain. The one caveat you can put on the headlines is it's predictable. They knew it was coming. And money, while the health ministers are asking for money, it's hard to see how money is going to solve their problem when you've got people turning up in ED. Part of the problem here is we've got a workforce crisis in general practice. People aren't going into general practice, and general practice can hold the line with situations like this and see people who might not need to be in the emergency department and triage them in a sense. But general practice is overburdened, and it's in a sense leaky in terms of its ability to hold the line, which is not the fault of individual GPs who are working hard. It's the system.
So is it the impact just of seasonal illness as well as those workplace shortages that you spoke of, or is it a bigger problem at play?
Well, it is a bigger problem. First of all, COVID is not seasonal. COVID is rising around the world. So COVID is not yet a winter illness. It just keeps on coming and going in a wave. But it does, the wave predictably does come in winter, predictably, but not only in winter. Immunization rates are low. The proportion of people who have not had their most recent COVID vaccine is worryingly high. And there are still a lot of Australians who haven't had their 3rd booster. If you look at people in residential aged care, people over 75, there's probably a 30% gap in people who are yet to get it. And if you look at influenza, which is also potentially a serious illness, our overall immunization rate is about 50-odd%. And in the vulnerable groups, so particularly vulnerable group is children aged not to 5, their immunization rate is 10%. And they're a vulnerable group. Pregnant women, we don't know what the rate is, and older Australians are still pretty low. So we could actually mitigate the burden of these diseases by improving immunisation.
You mentioned the shortage of GPs as well. So would lifting the restrictions on medical school places make a difference?
Not necessarily, because you just might get more of the same. If you don't change the settings, just increasing the funnel at one side will possibly just produce more plastic surgeons and general surgeons and dermatologists and so on, and not necessarily put people into the occupations that you want them to go in. The way to do that is to change the incentive scheme, pay GPs more, and stop talking about general practice so negatively, because it is a rewarding career, but we've got to change the structure of general practice to make it more attractive. We've already got quite a lot of doctors per capita in the population compared to other countries. They're just in the wrong specialties in the wrong parts of Australia. So just making them, we haven't got enough patients at the moment to teach students on. So I'm not quite sure what you're going to do with more.